Whenever we say Peyronie's disease, people think they have cancer in their penis. Like, don't see this as a disease. You can see it as a condition, maybe Peyronie syndrome. The way we define it is a condition in which the penis forms scar tissue. It will cause the penis to be shorter, curved, and it will cause pain.
This is the Man Up Podcast, the doctor's guide to men's health. Each week on our podcast, we interview the top specialists of the field on various topics in men's health. If you have questions that you're too afraid to ask, we have the answers. This week, our episode is titled Concerns About the Curve, talking Peyronie's disease with Dr. Jonathan Clavell. My name is Dr. Kevin Chu, and I'm here with my co-host, Dr. Justin Dubin. What's up, Justin? How you doing, bro?
I'm doing good. How is Taiwan, my friend? Greetings from Taiwan, right?
I am coming here from, the future, about a day ahead of the U.S. Taiwan is great. I'm here out on vacation, and it's just been fabulous. Been eating a ton of food, definitely vacation food, some of the fattier foods, but just enjoying it. The culture here is great. The city life here is amazing. The nature here is amazing. I really recommend to all listeners, if you ever get a chance, come visit this small island. It's awesome. The people are hospitable. You're going to have a great time.
That's now on my bucket list. I mean, I've hit a lot of Southeast Asia. I've hit up Korea. I love Asia. It's just a wonderful, wonderful place, completely different from what we're used to here. So yeah, I'm definitely checking that out. And obviously Taiwanese food sounds bomb. So I'm in.
It's absolutely delicious. Again, probably not the best in terms of healthy foods, but it's, the fish is fresh and the beef is tasty. So, it's really something special. But what's going on with you? What's new over there in Miami?
Honestly, nothing much, man. I'm by the time this comes out, I'll be doing the same thing I'm doing today. Just chilling, having a good time. I'm giving a talk at Northwestern, which I'm excited for, about direct-to-consumer telemedicine and andrology. So, it's going to be recorded. It's going to be on YouTube. I'm going to give that on Thursday, May 16th. We're recording this on Wednesday, May 15th. So, by the time this comes out on Monday, it'll be out on YouTube, hopefully. So if you're interested in direct-to-consumer medicine, if you're interested in telemedicine, or you're interested in the role andrology has in that, go check out my talk on the Northwestern Medicine Urology YouTube. So that'll be fun.
That's awesome. I mean, that stuff is super important now. I'm seeing a ton of it, right? I'm seeing a lot of DTC, seeing a lot of, these online TRT companies, and you've definitely done your little research into it. So, that stuff is extremely important. I think is actually, as we talked about before, the future for a lot of things, as long as it's done right.
Correct. And I think obviously this is going to have at least one episode in the near future that we're going to discuss this stuff. But today's episode that we're releasing, I'm very excited about. We have an incredible guest, and this is one of our live in-person interviews with Dr. Jonathan Clavell. He is a board-certified urologist practicing in downtown Houston. He is a fellowship-trained urologist in sexual medicine and an assistant professor in surgery at the University of Texas in Houston. His areas of expertise really include the penile prosthesis. He's a very high volume penile prosthetic implanter, treatment of erectile dysfunction or orgasmic dysfunctions. He also treats a lot of Peyronie's disease and complex Peyronie's disease. And he treats a lot of men after prostate cancer surgery. So, he is a really well-known, wonderful dude, wonderful surgeon, wonderful doctor, and good friend of ours, good friend of the show. I was recently at AUA in San Diego, the American Urology Association. I got to catch up with him, listen to him give some talks. And we're really, really lucky to have him on the show talking about Peyronie's disease, which is becoming a bigger and bigger topic in men's health and urology.
For the longest time, guys did not want to talk about the curvature of the penis. You just absolutely wouldn't. And, I think there's been such a good job done in terms of education over the past few years, in terms of bringing awareness, bringing that, hey, look, this is, other guys are suffering through this, and there are things that can be done. And so that's what we're very very lucky. Justin, you and I have been doing this for a while now, and we know what Dr. Clavell's done in this field in terms of, especially in the surgery side, just what can be done to get guys to help them with their condition and really improve their sex life.
Yeah. And, it is much more common than, our literature shows, because the problem always is guys don't want to talk about it. And when we're talking about Peyronie's disease, we go into a lot of what happens, how it happens, why it happens, or theoretically why it happens and how we treat it. We do a pretty expansive discussion on Peyronie's disease. But at the end of the day, there's a couple of things you always have to think about. And number one is bother, right? A lot of this is dependent on bother. A lot of guys come in, they see me, and today I saw a guy and he was like, listen, came in for other issues. And he says, oh, by the way, I got curvature. And we discuss the curvature. I do the exam. Yeah. And they say, well, does it bother you? And he says, doesn't bother me. Doesn't bother my wife. I said, do you want anything done for you? He said, nope. I said, all right, we're on to the next topic. So, bother is a big thing with a lot of things that we discuss. We talk about premature ejaculation. If you're ejaculating in 30 seconds, but it doesn't bother you, I'm not going to do something for you unless it bothers your partner. That's a whole other conversation. Right? But understanding the disease, understanding the pathology of the disease, understanding why me, sometimes we can't answer that, unfortunately, is part of this process. But it is something that we do see a lot. We can treat you if you want treatment. And there's a lot of different ways to do that. And I think that's one of the biggest takeaways you can get away from this talk today.
Absolutely. I love that point that you made there, Justin, regarding the bother. I mean, we talk a lot about it with other urological aspects, but in terms with Peyronie's disease, first off, I don't love the name. I don't know about if you agree with me, but Peyronie's disease, right? It's, I have a lot of guys come to me, they've done their Googling and they're like, oh man, I've got disease, and, much to alluded to what you're talking about, bother. Look, if you're not bothered by it, it's okay. You don't have to get it treated. It's not a disease that's going to cause something, much more insidious, to your overall health. So I love that point that you made.
All right, cool. Well, listen, so the other final thing, I just want to give a shout out once again to Dr. Clavell for coming on. It was a really great episode. He has a unbelievable YouTube. Honestly, one of the best urological education YouTubes. He's got thousands of followers, and I highly recommend you check out his YouTube channel for more information. Great information. I refer a lot of my patients to his penile implant information, to his Peyronie's disease information. He's got a plethora of knowledge out there. So I always recommend you guys checking that out too. But, I'm ready to get into it. What do you think, Kev?
Let's do it, Justin.
All right, guys. Thanks for listening. As always, check out the website. Check us out on all podcasting platforms: Spotify, iTunes, Amazon, and also YouTube. Right, you can see our beautiful faces. You can see Kevin from Taiwan right now, smiling with beautiful white teeth. Subscribe. We're really trying to push our YouTube, and also check out Dr. Clavell's YouTube. And thanks as always for listening, and have a good one. Guys, if you're listening to this podcast, you're probably interested in learning about your health. When it comes to understanding your fertility, there's no better test than the semen analysis.
For a long time, however, the process of getting a semen analysis was difficult. There were not many places to get it done, and when you were able to, you'd have to go to an office, uncomfortably provide a sample in a cold, sterile facility. Nothing easy or fun about that.
Fortunately, there is a new and better way to provide a semen analysis, and that's with Fellow. Through Fellow, you get an at-home semen analysis kit that sends you reliable results in less than 2 business days after providing a sample in the comfort of your home. And guess what? If you had a vasectomy and need to confirm that you are sperm-free, you can do that with Fellow from the comfort of your home too.
That's right. No more awkward trips to the office. No more worries about finding a doctor who provides these services. Simply go to meetfellow.com. That is meetfellow.com and order your semen analysis or post-vasectomy semen analysis kit, and they will ship it directly to your home.
Listen, we both love using Fellow for our patients, but the best part is you don't even need a script. Just go to meetfellow.com and purchase it online yourself. So if you or your partner are interested in learning more about your fertility status, check out Fellow at meetfellow.com and purchase a kit today. All right, we are live with Dr. Jonathan Clavell. Thank you for coming, man. Very excited to see you. It's always good to see you in person, first off.
Yeah, thank you. I mean, I'm excited to finally have the opportunity to be part of the Man Up podcast.
We've been waiting to get you on, so we are very excited.
Yeah, I mean, listen, you are a surgical master, a men's health master, so it's always great to have you on. So we're going to be talking about Peyronie's disease today, and I think it's always a good topic because in the last 5-10 years, it's really become a more popular topic, and it's something that people didn't want to talk about. But let's start off with the most important question to our listeners. What is Peyronie's disease?
This one I wrote down because I didn't want to screw it up. Every time a patient asks me that, I answer it differently. So, I mean, Peyronie's disease, which, by the way, first of all, I hate the term disease.
Agreed.
Yeah.
I completely agree with you.
Whenever we say Peyronie's disease, people think that they have cancer in their penis and their penis is going to fall off. And I always try to explain to them, like, hey, like, don't see this as a disease. You can see it as a condition, maybe Peyronie syndrome or something else. But I mean, that's the term, Peyronie's disease, and it is the way we define it is a condition in which the penis forms scar tissue and this will cause the penis to have three things. It will cause the penis to be shorter, it will cause the penis to be curved, and it will cause pain. Okay? And think about it. I mean, the penis is an elastic organ. And the way I explain this is the penis is like a sponge. It has two cylinders or two cigars that are like sponges. And around those cigars, there's this elastic sheath that surrounds the penis. And that's what gives the penis its elasticity and also its strength. And if you have an elastic organ that all of a sudden forms scar, which doesn't stretch out, then depending on where that scar is located, the penis then will start, creating a deformity, a curve. So if you have scar tissue, it will cause the penis to be shorter, right? Because the penis doesn't expand. And depending on where in that cylindrical sheath the scar tissue is at, the penis then will throw a curve. That's why it causes curve. And of course, if you have your penis not able to expand to its full potential, it can cause pain.
That's absolutely the way I also explain it to my patients. Now,
I actually explain it a little different. Can I?
Wow!
Yeah, tell me your spiel.
So my spiel is I have you picture your penis as a clown balloon, a balloon that you blow up, that you can make into like a toy poodle or whatever it is, and that layer is that tunica albuginea of your penis that traps all the blood. So when you get an erection, it's just like the balloon filling up, and you're pushing air into the balloon. Now, when you have Peyronie's disease, you have that scarring. And instead of, being able to blow it up, you're taking a piece of duct tape and slapping it onto that balloon outer layer. So when you blow up that balloon, that duct tape, it doesn't let that area expand anymore, that area of scarring, and it curves towards that direction. Yeah. And that's how kind of
I'm just imagining my penis as a toy animal.
Yeah, and then you can turn it into a poodle later or something.
Gotcha.
Wait, you guys don't bend your penis?
Wait, so Dr. Clavell, let's talk about a common question that all my patients want to know. Like, so you've gone through this description, you've explained to them, like, there's some scar tissue going on. But what causes this scar tissue to form in the first place?
So the true answer to that is we still don't know.
Exactly.
But I mean, we do know that there are risks, and there, that I usually tell people there's like three answers to that. I say number one, it could be genetics. I mean, we know that based on research studies in which there are other genetic conditions that can cause scar tissue, and men who have those other genetic conditions, they can also have scar tissue formation in the penis. Number two is trauma, be it the big one, which is, penile fracture.
Mm-hmm.
I mean, yes, the penis can get fractured. Have you guys talked about it in Man Up? About penile fracture?
We have. We should.
That's a good topic for you guys to bring up.
Really good.
So it could be again the big one, or it can also be microtrauma.
Right.
And the third one is actually erectile dysfunction, and which is one thing that many people don't think about. And I'm going to give you guys a glimpse of my talk tomorrow. Tomorrow I'm having a talk on.
Oh, we're getting a preview.
Just don't tell anybody about this. But I'm talking about the relationship between erectile dysfunction and Peyronie's disease. And one of the things that I'm going to present is, first of all, I'm sure you guys have watched Rocky.
Of course.
Oh,
Rocky.
yeah, absolutely.
Rocky Balboa. Rocky 4, right?
Yes.
With Drago.
Yes.
And you guys are probably thinking, like, what does Rocky have
I'm
to do?
trying to
Yeah.
get the linkage on this.
I'm intrigued where you're going.
So with
here.
Peyronie, I mean, what I'm going with this is, and this is something that I got from Dr. Kara, and he explains this way. It's like, if you have a 100% rigid penis, like this is like Rocky going in to fight Drago.
Okay.
Okay.
Again, even though it gets a beating, it can sometimes survive and it can remain victorious. So a 100% rigid is very unlikely to have microtrauma. And the same thing goes with with a penis that's less than 50% erect. So I always ask my patients, like, hey, how strong of an erection do you have?
Yeah.
And we all know that the erection is gradual, right? It can be from 0%, which is us three right now. We're not aroused right now.
Yeah.
And
Speak for
100%, which
5% right now, actually, as we keep.
I'm about a good 75% right
just
now.
to keep it alive. Just to keep it alive. So that erection that's less than 50% erect or 50% rigid, it's probably too floppy. So that's like throwing a gummy worm penis, being thrown into the ring.
Interesting.
But the problem lies when the erection is about 70 to 80%. So it's good enough for penetration. So this is like Apollo Creed going in.
Yeah.
And again, it's, he's confident. He trained for the fight.
Yeah.
But he's too cocky, pun intended. And what happens is, again, that when it goes into a boxing ring, which sex is a traumatic event, we know that. And what happens is the penis can start buckling. And when it starts buckling, it can create microtrauma. When it creates microtrauma and you're not healing well, then you start forming scar tissue, which is collagen.
That's fascinating. I've never thought about that.
That's interesting. And that kind of puts that, if you're at that 70%, 80% rigidity, you're actually kind of putting yourself in danger.
Exactly.
Huh?
That's the issue. So,
Wow.
I mean,
Another reason to see us sooner.
we can talk about whiskey dicks here, but but yeah, I mean that's usually what happens. I mean, it's something that we have to be cognizant about, right? I mean, it doesn't mean that if you have an 80% erection you cannot have sex, but you have to be careful. I mean, you're not going to be doing all the crazy positions, right? So again, not everybody gets this. That doesn't mean that erectile dysfunction will necessarily cause Peyronie's disease, but it could be one of the causes.
It's very interesting. And that kind of leads to the next question, how common is Peyronie's disease? Because, I alluded to in the beginning that, it hasn't really been talked about for a while, and there was big stigmas on this curvature. How common do you think Peyronie's disease really is?
In my opinion, it is very common.
Yeah.
Right? I mean, research studies 20, 30 years ago, they suspected that it happened in less than 3%.
That's crazy. That's not true.
But now more research studies, the newer research studies that are looking at the whole population, they basically say that it could be between 10 and 13%. So that's basically 1 out of 9 men. So if we were sitting at a bar tonight and there is 10 people, we can look at each other, and one of us is probably going to have it.
I actually think it's probably higher than that.
I agree with you, because again, what happens now is, like, now people, thanks to guys like you who are bringing up this content and we're speaking up about these conditions, people are finding out that there are options. Now we have the carrot commercial, even in Sirius XM. I mean, you're listening to sports radio, and all of a sudden there's like bent PD or bentpenis.com or whatever.
You look down, you're like, oh, yeah.
Is that a problem? Which that could also create another problem, because now you have a lot of guys who come in thinking they have Peyronie's and they don't have it.
Right.
Which is another talk for another day, right? But yeah, so people are speaking up. So the way I see it is, for decades, I mean, probably hundreds of years, men were living in caves. We were living in caves. We were scared that we were having this condition, and we thought that there was no solution for it. Again, nobody used to talk about their penises. I didn't talk to my father about my penis, right? So this is something that nowadays people are speaking up more about it. It is a more common theme. Therefore, people are seeking out those. So yeah, it is. I think it's a lot more common than what we think.
Yeah, for sure.
It's definitely been an underdiagnosed thing for a long time. And now there's more mediums to kind of get be informed to talk about it. You got guys like Justin talking about it all the time, you know.
Well, you know, I think there's also this level of bother, which we'll obviously get into too. But you know, just because you have something doesn't mean you need to do something.
That is correct.
No,
that is correct.
that's a
And
good
again,
point.
it is very common. That does not mean that everybody needs to get treated.
Correct. Now, I guess the next question is, you know, you alluded to it before, you know, it's called Peyronie's disease, but people don't like that name. You guys don't like that name. I agree with you there. Does having Peyronie's disease mean that I have other health issues? Could this be a sign or symptom? Because a lot of things in men's health, when we talk about erectile dysfunction, we talk about diabetes, heart disease, all this stuff.
Early sign of something.
Is there some other concerns if I have Peyronie's disease that I should be thinking about?
So that is a tricky question. And I would say yes and no at the same time. Even though we do not know what are the causes, we do have risk factors. For example, men with high cholesterol. It's actually been proved, you know, but there's been some studies suggesting that high cholesterol could put men at higher risk. Diabetes, we know that. I mean, there's, I think there was a study that 20% of men with Peyronie's disease also had diabetes, or vice versa. I really don't remember. Don't quote me on that.
Right.
Yeah.
But yeah, men with diabetes are at higher risk of developing that condition. So I've seen that in my office sometimes. A guy comes in with a curvature, and then we randomly do a urine dipstick. It's like, dude, you have diabetes. You didn't know. Or they come in, they drop their pants, and now you see they have a really bad balanitis. Like, hey, have you got your glucose checked out? So yeah, I mean, it could be a sign of another, you know, medical condition. But at the same time, I've seen many men who are super healthy, like these two, you know, beautiful gentlemen here. And all of a sudden they show up with this condition and they're like, docs, like everything was fine. And all of a sudden my penis now starts changing and I have this problem, like what's going on? And they don't have any other medical conditions. So it doesn't mean that it is a sign, the same thing as either erectile dysfunction. There are guys who have erectile dysfunction that they could otherwise be healthy, but it could also be a sign of another thing.
I want to stress, for the longest time, Peyronie's, I think, wasn't like very well studied, right? And now more and more, as more attention is being paid to it, I think we're getting more research on there.
I think what Kevin is just saying is like now he's studying more, and that's what.
Maybe that's it. So let's talk about now. In terms when we talk Peyronie's, there are two phases, right? There's the acute phase and the chronic phase. So can you tell our listeners just a little bit about both phases and what they mean?
Sure. So the acute phase, yeah, you're correct. There are two phases. The acute phase is like when things happen all of a sudden, things are still changing, things are dynamic, and it's also characterized by pain. And then the stable phase or the chronic phase is usually when it's been at least 3 to 6 months and things haven't changed. And then usually the pain usually goes away during the stable phase. I'm going to say usually, not always. But usually those, in broad terms or layman's terms, that's usually what we define the acute versus chronic. And depending on where you're at, that's when we decide, it's like, hey, you know, what can we do to help you out, you know, for your condition.
Yeah, and I think that it's important to understand that just because you're in the acute phase doesn't mean that you shouldn't get help or anything like that.
That's right.
You know, it's just how we talk about it. It doesn't mean that we can't treat it because you're in one phase versus the other. I think that's just important to understand that.
No, definitely. And then when it comes to pain, I mean, I always try to clarify this with, you know, all of my patients whenever they show up. Like, if you still have pain, that does not mean that you're still in the acute phase. I mean, there are guys, I mean, when I was a resident, we were always taught, like, oh, if they have pain, they're still in the acute phase.
Right.
Follow up in 6 months.
Right, yeah.
We did a year.
Oh, shit.
So when I was a resident, we had a busy clinic. It's like, oh, does it hurt? Yes. See you back in a year. And that's the end of the conversation. But nowadays, again, we also need to understand that there could be men who have discomfort, right? If you have the balloon with the duct tape and the balloon is not able to stretch out all the way because of that duct tape, man, it's going to hurt probably. So, and pain, usually I try to always clarify with my patients, like, hey, do you have pain or do you have discomfort? Like, pain is what you all of a sudden wake up in the middle of the night, you're like, what the heck is this? And usually that's what most men say. It's like, hey, doc, like, all of a sudden, I mean, we're only used to feeling pleasure, or depending on what you do at home, you can also have pain, but usually it's pleasure, and all of a sudden you start noticing pain. Yeah. But most of the time, that eventually transitions to just discomfort. And the stronger your erection, again, the more or the harder that scar tissue's at, or the harder the scar tissue, the more the penis gets restricted, you can be uncomfortable. And the discomfort is, I always ask them, like, when you have sex, are you thinking about the pain or you're thinking about the pleasure?
Right.
And they tell me, oh, doc, it's actually the pleasure overcomes whatever discomfort. It's like, well, you're good.
Right. And I think, when it comes to Peyronie's disease, it is for a while it's a dynamic thing, which leads to the question of, for some guys, can Peyronie's just go away?
It can. In my experience, it doesn't. But most of the time, yeah. There are multiple treatment options now, and we're going to talk about that later. But there was one study back in 2006, about almost 20 years ago, and they looked at 200 men, and they came in with the concern of Peyronie's disease, or they were diagnosed with Peyronie's disease, and they just watched them for a full year, and they didn't do anything to these guys. And what they found was that 15% of men got better, 45% basically stayed the same, and 40% got worse. Okay, so what I usually tell people is, you have about a 15% chance that this is going to get better on its own. Okay, and you have about an 85% chance that it will either get worse or it will just stay the same. And it's just a matter of, what do you want to do? And then we talk about treatment options. Like, are you bothered? Erectile function. We'll talk about that in a minute.
All right. So one of the big questions that a lot of my questions asked, and I think Justin was alluding to it earlier, is, do you have to absolutely do something for Peyronie's disease?
So that's a great question. And the answer is no. We don't always have to do something. That's why I do not like the word Peyronie's disease. Right. Because with the disease, we usually need to treat it. Right. And the wonderful thing about this is that, again, this only affects your quality of life and your sexual life. So this is not going to affect, generally, this is not going to affect your urination. Right. But we treat this depending on two things: the degree of erectile function, like how good of an erection you're able to get, and how bothered you are. So if you have a good erection and you're not bothered, doesn't matter how bad of a curvature you have, how bad the pain is, or how short your penis is getting, you really don't have to do something about it.
Yeah, I think some patients have actually come to me say their partners enjoy the curvature more.
Yeah.
And that's a real thing. It's
true. I've had guys that they come in, it's like, hey, doc, I want to get it treated with either Clavell injections or surgery, and the wife is behind them like, like, don't treat it.
I think a lot of that comes from what you were talking about at the beginning, that the name of this is Peyronie's disease. Mm-hmm. So when a patient sees that, they're like, oh, my God, this is a disease process. Mm-hmm. I need to get this treated, but you don't need to.
And I will never forget, man, I once had a guy who came in and the penis was like this. It was like a 90-degree vent, like going sharp, sharp hook going down. And he's like, doc, I just want to make sure this is not cancer. I'm like, it's not cancer. He's like, okay, well, great. I'm like,
that's awesome.
Good for you.
Yeah.
See you later.
So, so obviously you don't need to treat it, but now say the patient comes in, it's hard, but they don't really like how it looks. Or their partner doesn't like how it looks, or it's painful. And sometimes it's painful for the partner too. We forget about that aspect of it. Mm-hmm. Now, they want to get treated for their Peyronie's disease. And obviously there's a lot of options out there. But let's break it down from least invasive to, most conservative to the more invasive. So, let's talk first about oral medications. Mm-hmm. What are some oral options for Peyronie's disease treatment?
So the answer to that is there's not many. And there's not many. There's not good ones. Let's put it that way. There are many things that have been tried in the past, like vitamin E and colchicine and L-arginine. There's so many, like pentoxifylline, so many oral medications that have been prescribed in the past. But what research has shown is when we try to replicate the research studies, it's they really don't work that well. Right. So what I tell people is I go based on the guidelines. I tell them, hey man, we can give you can take all the pills that you want, like all the anti-collagen medications, and they're not necessarily going to work. However, one that has shown some promise is what I call vitamin Cialis or tadalafil. And there was one research study that was published last year And they looked at many men who, it's like, I think it's like over 1,000 men who were taking this medication during the acute phase. And they wanted to see if, like, how things progress while they were taking the medication versus those that were not taking the medication. This was a retrospective study, so they were looking back. So they thought about this after they already got treated.
Hey, it's a good idea to think about it.
And they saw that patients, they didn't progress as much when they were taking the medication. The good thing about this medication, it's been proven to be safe. That's why I call it, again, vitamin C. All we're doing is dilating the blood vessels to bring blood flow into the penis. So I tell them, hey, this is not necessarily going to help it. It's not necessarily going to prevent it from getting worse, because again, we don't see that as scripture, that study. We don't take that as scripture, but it could, it's not going to hurt, so you might as well try it.
I give Cialis pretty much to every one of these guys.
Too. I'd give it like if it was Skittles.
And I got to tell you, I've had a lot of positive feedback.
I have too. Yeah.
Like a lot of guys, and maybe it's just kind of alluding to what you were saying before. Maybe they just weren't getting as hard of erections. And I think getting that harder erection has given them a more satisfying sex life. But I really give Cialis to everyone. I know some people also do Viagra, but I prefer the Cialis just because it lasts longer.
Exactly.
As we know. Yeah. And so, yeah, I'm a big proponent of the daily Cialis route.
And right now, that's the only medication that I prescribe my patients, for Peyronie disease. Again, if they have a 100% erection, I'm probably not going to do it. But
I still do it. Because I think theoretically...
Justin just gives everyone...
because, like, listen, that data, I think theoretically, if you think about increasing blood flow, increasing healing, like
it's
physiologically, it makes sense why a medication like that would help, right?
All we're doing is delivering oxygen.
Correct.
Oxygen brings life.
And it helps healing. It helps, maybe is it preventing scarring? Maybe it's preventing it from scarring more. So, yeah, maybe...
You bring more growth factors and stuff there from the increased blood flow.
And believe it or not, like, even for patients recovering from surgery, sometimes that medication, I've had guys, I don't take this as scripture, but I have guys that heal sometimes a little bit better.
Right.
And there are now, I know, like, in the reconstructive world, they're using it to help with urethroplasties and stuff like that. So I'm like, why don't I just also give this for a guy who is undergoing surgery in the penis, be it for a penile implant or be it for Peyronie's disease surgery. So that's something that, again, vitamin Cialis.
Vitamin Cialis. Well, let's talk about these retraction devices, or VEDs. How do you use them for Peyronie's treatment?
So the theory behind it using traction, again, goes back to those genetics stuff that we talked about earlier. Again, there is a condition called dupuytren's contracture in which guys have scar formation, and women can have scar formation in their fingers, and then the traction helps to bring everything back to where they were. Right? You want to restore or break down the scar tissue. In practice, the one that I use is Restore X.
Same here.
And the main reason is because of time. Because, I've given talks about traction therapy, and all the studies were like, and men were recommended to use this for 3 to 6 hours. And I'm like, who has 3 to 6 hours a day to be pulling on your penis? Except Kevin
home.
here.
Work from home.
I do, actually.
But that's just for fun.
So the good thing about the Restore X device is that in their studies, that men were using it for 30 to 90 minutes. So on average, it was about an hour. And it showed that they could actually regain some length back. And it could also help with the curvature. And we'll talk about, once we talk about the other part, which is the injections, I'm pretty sure that's going to be the next question, right?
Yeah, we can talk about that right now. So, obviously there's another thing called Xiaflex, collagenase, and that's becoming a very popular treatment. I think we all treat, as men who treat men for Peyronie's disease, it is always in our tool armament. Now, tell us about Xiaflex, what it is, how it works.
Yeah, so Xiaflex, just like you said, it is the only FDA-approved drug for Peyronie's disease. Okay, so and what it is collagenase histolyticum. So collagenase is an enzyme that breaks down collagen. So what we're trying to do is this is an injected medication. So going back, there are no creams that are going to treat Peyronie's.
Right.
So you can rub on it as much as you want. It's not going to do anything. So we have to inject this medication directly, this enzyme directly into the scar tissue, and that will help break that scar tissue. However, again, breaking down the scar tissue is not going to fix your penis, right? It has to be the injection with exercises, what we call modeling. And that's when the traction therapy really, pays off.
Yes.
So what I tell men is I am not a big believer in Xiaflex alone.
Yeah.
I am not a big believer in RestoreX or traction therapy alone, but both of them together, I am a believer. And there's actually been good research studies, for example, doing Xiaflex and having guys kind of like stretch it out at home. In the industry-sponsored studies, what it showed was that you could improve the curvature about 30%. So if you have a 90-degree curvature, you can kind of like go, it's like 60 degrees, which is still not great. But in the studies combining both traction therapy with RestoreX device and the Xiaflex injections, usually they had like half of guys had over 50% improvement. So that's a guy who can go in from a 90 degree now to 45 degree. Man, a 45 degree curvature, there are many men who are able to use that.
Right.
So again, it could be a game changer using both of them together.
So do you use both of them together, Justin?
I do. But the realistic thing is, the RestoreX device specifically, a lot of these devices are not cheap, right?
Not cheap.
And it's a $500 device, and sometimes they cannot afford it.
And usually what I tell my dude, people will cut their arms off to make their penis work, right?
That's true.
And I know, it is a big concern. And yes, sometimes they are worried, but I tell them, it's like, hey man, it's like, how much money do you think your penis is worth, right? And this is something that can really help them. And it's very, very rare that I find a guy that they tell me, hey doc, I'm not going to be able to do this because I'm not able to afford.
That's great perspective right there. That's exactly the way that,
this is for your health. We're doing this for the health of your penis. And if you want to be able to go back and engage in sexual intercourse and not have any major problems or concern with your partner.
Listen, I offer it to everyone. And some people decide to buy it or some don't. I can't,
No, you're gonna force them.
Right. But I agree.
You can say, I'll take it out of my paycheck.
No, I'm good.
Go broke.
Justin's like, back up. So let's actually move on to something that I'll tell you that Justin and I respect what you've done, and we've learned from you in this kind of area. Just talking about surgery for Peyronie's. So can you describe the options to our listeners?
So when it comes to surgical options for Peyronie's disease, we usually break them down into three categories. There's plication surgery, there's plaque incision and grafting, and there's also penile prosthesis. And I know for those who are not in medicine, I just spoke gibberish to you guys.
Right. Yeah.
It's like, what?
So let's talk about these things. So again, remember, this is scar tissue, and we can even use your analogy, right? The analogy that you use with the balloon using duct tape. So plication is what we're trying to do is we're trying to, on the healthy side of the penis, we're trying to get a piece of duct tape. Right, so we're placing something that will help the penis stretch out on a uniform manner and staying straight. So it's easier given that we have a camera. So again, if your penis curves like this, what we try to do is we try to put a stitch on the bottom side of that penis, and sometimes by closing up that stitch, the penis would now be straight.
Yes.
But what's the issue here? Again, we want a balloon, that we want that balloon to stretch out as much as possible, and if you put in a piece of duct tape on the top, your penis got a little bit shorter. Now you put a piece of duct tape on the bottom. Now your penis is getting even shorter.
Right.
And what can happen most of the time is that we can risk penile shortening. However, that being said, in my experience, most of the time, what they lose is sometimes less than a centimeter, maybe 1 centimeter. Again, a centimeter, not an inch. So we're talking about less than half an inch. And most of the time, you don't notice that half a centimeter. So if you're having sex, you look at it down there. It's like, it's really not that much shorter. So it is a great option for men who have good erections. Okay, and they're willing to risk that shortening. The other option, which is a little bit more invasive, which we usually reserve for guys who have more severe curvatures, what we try to do is try to cut now that scar tissue. But if we cut that scar tissue, what's going to happen is you're going to develop now a defect or a hole in the penis. And if you leave a hole in your penis, where the blood is supposed to stay trapped inside, all that blood is going to leak out. So we have to patch it, right? So we have to put a patch on to cover that hole. other risky part about that is that, as us as surgeons, is that we have to, in order for us to get access to that scar tissue, we have to do a lot of dissection. And what happens specifically, which the most common curvature that we see are the curvatures that are going up. On the top side of your penis are the nerves that give you the sensation. So we have to elevate those nerves, and we have to be really careful with that, right?
Yeah.
So whenever we offer this option, yes, it can help restore some length. I don't like using, we're going to make your penis longer. Right. We're going to try to restore as much as we possibly can. And yeah, but we have to do a dissection for that. And then when you have men who have both Peyronie disease and erectile dysfunction, which again, these come in hand all the time, which is going to be my talk tomorrow. Right. When they come in together, sometimes a penile prosthesis can really help them.
Yeah, and I think to kind of summarize, the question becomes, which one's the right one for me? It was such a great summary of the surgical options. I think, how good your erections are is a component.
That's right.
How big is the curvature?
Yep.
Are you okay with losing some length? Are you opposed to surgery? Because, once again, the Xiaflex. And, I think that what's really cool about everything we talked about today is you can choose your own flavor. So a patient comes to you, they come to Kevin, they come to I. We have these options. We have our tool belt. And we can say, for the most part, this might be the best option for you. But if there's a different versions of that, they can kind of choose their path.
Yeah, the way I explain this to patients when they decide what's the best treatment for me, it's what I tell them is okay, it all depends on what you just said. I mean, there's the clinical or the doctor side. It's how good of a erection you have, how bad of a curvature we're talking about, what type of deformity you have. I mean, is your penis also indenting? Is it creating a hinge? Is it all floppy beyond the scar tissue? Right. But the most important thing is what I counsel my patients, what are you willing to risk?
I like that.
That's what I tell them. And I ask them, are you willing to risk a little bit of length? Go with a penile application. Are you willing to risk erectile function and because you don't want to lose any more length? Then, we can do a plaque incision and grafting. Are you willing to risk time? Right? Because with Xiaflex, yes, it is but we have to remember it doesn't involve surgery, but it is a process that sometimes that process from the time that you start to the time that you see them after their last cycle, it can take 6 months. So it's how quickly do you want to get this treated? That's something that we also have to take into consideration. And of course, if you have a really bad curvature and I tell them, hey man, you want one surgery, you want 2 surgeries. And it's this is very likely you might end up with erectile dysfunction with the severity and how big of a scar tissue you have and how much reconstruction we need to do. And those men can sometimes benefit from a penile prosthesis.
One of the things I talk to my patients about is aesthetics important, right? Is how straight your penis.
That's right.
If you want it to be straight, Xiaflex, I love it. It's a great treatment, but if you want it absolutely straight
like an arrow, yeah. So it's true, and that's a conversation that we have to define goals. Us as the doctors and also with the patients. What is your goals? What are you willing to? What are your what you're willing to risk? But also where do you want to get to? Right. And again, we have to sometimes counsel them. One thing that's very important is it is very hard because most of the time the answer to that, it's when you ask them, I'm pretty sure it happens to you guys as well. When you ask a patient, it's what is your goal? I want to be back to where I was.
Yeah.
And what I tell them is hey man, that's long gone. That's long gone. But we can get you better than where you are right now.
There you go.
I think that's a great way to end it here and summarize it. This was awesome. Can you just tell our listeners where they can find you?
So I'm currently in Houston, Texas. Most people find me online. I have Twitter, Threads, Facebook. Everything's Clavell Uro.
Your YouTube's fantastic.
Oh, YouTube's fantastic.
Incredible.
Thank you. Yes, so I have a YouTube channel. It's Clavell Urology. You can also do at Clavell Uro, Clavell URO. I just try to educate, just like what you guys are doing, spreading the word, letting people know that there are experts that are willing to help them out and listen to them.
All right. Well, thank you so much for joining us today. Really appreciate it.
Thank you, man. I want to be back.
Oh, you will be. You will be.